Hello, so this video is reasons sex could be painful and how to relieve them. So you just finished a sex session with your partner, but instead of basking in the afterglow, you realize that something is hurting down below. Maybe it's a dull ache inside your vagina or a burning sensation closer to your vulva, or more of a sharp pain deeper inside into your pelvis. Whatever's going on, you know it isn't normal. Sex is supposed to feel amazing, not leave you wincing. The first thing to do is to get an idea of what might be behind the pain you feel. Then talk to your doctor about it. Here are the most likely and a few rare but possible explanations. So 1, you have a UTI. 1 in 5 women experience a urinary tract infection at some point in their life. According to the National Kidney Foundation, pain in and around your pubic area is one of the most common symptoms. What's going on? Inflammation from the infection can cause spasms in the muscles surrounding the pelvic organs, explains Dr. Einberg. When you have penetrative sex and your partner's penis makes repeated contact with the vaginal wall, these spasms can be exacerbated and really hurt. Picture someone punching you firmly over and over in the same spot on your shoulder. The muscles may become sore, and a natural response may be spasms of the muscles. The same thing happens in the pelvis and the muscles surrounding the vagina and pelvic organs. So what to do about it? If you have other UTI symptoms such as foul-smelling pee or pain while urinating, let your doctor know. Relief can be just an antibiotic prescription away. The partner's penis is too big. Here's a time when size does matter. Anatomy plays an important role in pain after sex. If your partner is on the well-endowed side, the muscle groups surrounding your vagina and your pelvic organs can cramp up and stay that way after the bumping and grinding is over. The average female vagina is no longer than 5 inches or so. Therefore, the average male, who may be 6 inches long, may still cause significant trauma to the pelvic floor that can cause post-sex cramping. So what to do about it? If your significant other is particularly lengthy and after sex you feel your vagina feels raw, even though you were super aroused and used plenty of lube, experiment with positions that make an XXL penis fit better, like spooning or woman on top. You have an ovarian cyst. Most benign ovarian cysts are fluid-filled structures on your ovaries. They tend to resolve themselves in 2 or 3 months, without you even knowing you had one. But sometimes ovarian cysts trigger achy pain, typically in the lower right or lower left side of the pelvis, where your ovaries are. If they're large enough, ovarian cysts can cause abdominal pain and cramping during and after sex. So what to do about it? Most cysts stay under 4 inches, but some can grow much larger. And these large cysts additionally can torse or twist, which can be exceedingly painful. Your OBGYN would have to do an ultrasound to see if you actually have a cyst. And then treatment would likely be watchful waiting. If she confirms that you do have one and the pain is getting too much, you may have to have surgery to remove it. So then you may have endometritis. An estimated 1 in 10 women have endometritis, a condition thought to be caused by uterine tissue that has migrated into the pelvic cavity, says Dr. Gaither. That tissue may adhere anywhere in the body, but typically it stays in the pelvic cavity and forms cysts on the ovaries. The peritoneum, the membrane that lines your abdominal cavity, the bladder, and around pelvic muscles. If the tissue adhesions are behind the vagina, penetrative sex can result in pain. Not all women with endometriosis will experience pain during or after sex, but if you do, it will likely be more of a deeper kind of sharp or stabbing pain. Other signs include killer menstrual cramps and pelvic pain all month long, even out of the bedroom. So what to do about it? It's not curable, but medication and surgery can relieve symptoms, so let your doctor know if you suspect it. You have pelvic inflammatory disease. Pelvic inflammatory disease is an infection of the organs of the upper reproductive tract. It's typically the result of an untreated sexually transmitted infection, such as gonorrhea or chlamydia. As the name states, it's an inflammatory condition that can lead to pelvic pain, scarring, and even infertility. During sex, you'd likely feel the pain deeper into your pelvic area, where your upper reproductive organs are. So what to do about it? If you suspect PID might be the cause of your pain, you should see your OBGYN as soon as possible. PID needs to be treated with antibiotics. You're allergic to your partner's semen. It's super rare, but semen allergy is actually a thing. As many as 40,000 women in the U.S. are allergic to their significant other's semen. According to a study review from the University of Cincinnati, if you're experiencing this kind of allergic reaction, your symptoms could be local, like swelling or itching, or systematic. Women may feel severe burning, develop a significant discharge, or even have whole body reactions such as chills, fever, low blood pressure. If you have sex with a condom on and don't experience any of these symptoms, an allergy may be the culprit. So what to do? A doctor can perform skin prick tests to give you a more definitive diagnosis. Treatment includes medication and desensitizing shots. Sure, it's a buzzkill, but many women report that their symptoms lessen as time goes on. You weren't aroused enough before sex? Chafing caused by lack of lubrication during intercourse is the number one cause of post-sex soreness. Sometimes we get carried away in the heat of the moment and we don't always realize how much friction there may have been. Even if you know you're in the mood and can't wait to start twisting the sheet, your body might need a little more time to catch up, and there's nothing weird or abnormal about that. So what to do about it? Before intercourse, make sure you to indulge in lots of foreplay, enough so that your vagina swells with excitement and becomes sufficiently lubricated. How wet you get can also be influenced by pregnancy, breastfeeding, where you are in your cycle, and even medications you're taking. So if you need an assist, don't hesitate to use water or silicone-based store-bought lube. And if you use condoms, keep the lubricated kind on hand for extra wetness. And then finally, sex was too rough. Part of the thrill of sex is experimenting with different positions. But in the rush and excitement of trying out something flexy and acrobatic moves, it's very possible that you ended up in a position that puts extra pressure on your vagina or vulva that can lead to feeling sore afterwards. What to do about it? Well, every woman's body is different. Avoiding having sex from behind, which can create that extra pressure and friction at the vaginal entrance. And always let your partner know if he's going too fast or penetrating you at an angle that just doesn't quite work for your body. So that's it. Thanks for listening.